It is one of the most dreaded visits, but a visit that can save one's life if done on time, followed by counseling. VCT centers have for some time provided HIV testing to many, but with the introduction of self-testing kits, the burden has been eased.
This self-testing?
It is expected that through the kits, Kenyans will be at a position to know their status and eventually prevent more infection or start treatment on time.
So you can do it in your own privacy. You can do it in your home. You can do it at work. You can do it wherever that you feel comfortable with.
A 2016 research titled The Assisted Partner Notification Study estimates that about 500,000 Kenyans are unaware that they have the HIV virus, and this has perhaps informed the introduction of a self-testing kit.
These 400,000 are mainly the men, the youth and the adolescents.
Many see the innovation as a big step in normalizing HIV testing and giving people privacy instead of being embarrassed to get tested at a clinic or public facility. The Director of Medical Services, Dr. Jackson Kioko, says that the kits will be acquired over the counter for between 700 shillings and 800 shillings. To know your status, one can use blood samples or a swab. If the test is positive, you can visit a health facility for confirmation of the status. On the other hand, PrEP will be available to people who are at most risk of infection and will be rolled out for free by the ministry in various facilities. They will also be available in private facilities only with a prescription at 120 shillings for a daily dosage or 3,600 shillings for a monthly dose. Other than discordant couples, people with multiple sexual partners, those who have had sexual transmitted infections, people who inject drugs, and sex workers will also be targeted in the initial rollout of the prevention drug before it is available nationwide.
Regardless of our status, if we turn negative, the better. Take control and stay negative. But if it turns positive, we need to go and seek more medical attention. Okay. Yes.
The drug is a combination of two antiretrovirals. Therefore, users may experience side effects such as headaches, nausea, weight loss, vomiting, abdominal pains, but this will fade off after a few weeks.
Only for that season when somebody's life or environment puts them at risk for HIV infection. So it can be start, stop, or continue for 3 years, stop. Of serodiscordant couples, just 6 months or until their partner is virally suppressed.
A study done in Kenya and Uganda has shown that when taken daily, the drug can prevent HIV infections by up to 96%.
Meanwhile, we won't do it right now. Let's go and have lunch.
Eunice Omollo, NTV, Nairobi.